Welcome to Local Edition. I'm Brad Pomerance in Long Beach. Today we are joined by Hector de la Torre. You know him well. He was in the California State Assembly. He is now the executive director of the Transamerica Center for Health Studies. And I want to speak with you, sir, about the Affordable Care Act.
Or what may happen to it.
Or what may happen to it. I have had the good fortune to speak with legislators in California, a blue state, in Nevada, a bluish state, Idaho, a red state. They're all nervous about the Affordable Care Act, specifically with regard to the exchanges and the Medicaid expansion. Let's start with the Medicaid expansion, because that's where even red states are a little nervous, because many of them accepted the expansion. Idaho, Kentucky, Nevada.
Yeah, about a dozen states,
Right.
red states, expanded Medicaid in their states. It was a good deal, right?
Right.
It's 90%, 100% federal match in the beginning, 90% now, for federal money to expand Medicaid, a significant growth. So if you're an individual, there was about a $5,000 increase in the income level that would
Right.
qualify you for it. Plus, adults without kids could qualify for it. That was the first time ever.
Of course.
Usually, an adult had to have a kid, and only under certain circumstances. So they opened up the adult portion of it so that it wasn't just kids and the really sick adults. Now it's pretty much any adult that meets the income requirements.
So as we speak, we don't know what's going to happen with the Medicaid expansion. There are rumblings that the Republicans in Congress are looking to roll it back, eliminate it. But what we know is that governors are complaining. They're concerned. We have someone like Brian Sandoval in Nevada, who is a Republican governor in a bluish state. He's talking about how he's concerned about the elimination of the expansion. Even someone like Matt Bevin from Kentucky, a Republican, he is concerned because the expansion's been successful there.
And it was a great deal. Again,
Right.
you're getting 100% match in the beginning, 90% federal match today to fund this expansion. It was a really good deal, and we've seen the numbers grow. We have over 11 million people in Medicaid, additional people in Medicaid today than we did before the ACA.
So you've been tracking this. What are you seeing? Again, we don't know what's happening. Events are moving quickly. But do we have a sense as to where we're going to go with the expansion?
The proposal on the table right now that's being talked about behind closed doors in Congress is to eliminate the expansion. So you would roll back that income level that I mentioned back to what it was in 2010, which is 100% of federal poverty, about $11,000 for an individual, and about $24,000 for a family of four. So if you make below that, you would qualify. Anything above it, you're on your own.
So what happens to those folks? I mean, you have 11 million people that are now covered. If they're not covered, whose responsibility are they? They're still going to have health care needs. What happens in, for example, California?
Well, if California any of these states could continue to do it on their own.
But
so
they've
in
been
California,
getting 90% from the federal government.
So in California, that would be about $10 billion that we don't have.
Right.
That would be over 10% of our general fund budget. So we don't have that kind of
Right.
money to backfill the amount. So those people would be on their own.
But the Republicans in Congress have said they're looking at maybe replacing the expansion with a block grant that would go to the states. Is that?
The block grant would kick in after they reduced the expansion. So it wouldn't be the expansion plus a block grant. It would be
Right.
roll back the expansion back to 2010
Sure.
levels, which is all those 11 million people lose their insurance, and then the people who remain in Medicaid, most of which are children at that point, because you've gotten rid of the adults, would be within Medicaid, and then you'd have a block grant. And over time, because of block granting is fixed, you would lose money from the
So
federal
the
government.
level would be dropped.
Exactly.
And
Over
so the
time.
states couldn't even choose to expand on their own with that block grant money?
No, they could, but they'd have to backfill. Again,
Right.
it's $10 billion in California and billions in other states as well. No state, I would venture to say, can afford to backfill.
So let's talk about the exchanges. Many states, a good number of states, adopted their own exchange. Some went through healthcare.gov. In California, arguably the exchange was quite successful. I mean, there are issues, no doubt. Where do we go with the exchanges? What do we hear out of Capitol Hill in Washington?
Well, the issue there, the exchanges themselves, they probably will lose funding from the federal government.
Right.
They've been heavily subsidized from the federal government. But the real issue there is the subsidy for the individual consumer.
Right.
The tax break that is advanceable and has been used to create discounts for the consumers. In fact, over 80% of people in the exchanges get some kind of a discount because of their income. They're going to roll that back and not make it an advanceable tax break. So you could get the tax break, but you'd get it at the end of the year. That's not going to help people month to month paying their premium.
And we've also heard that the Republicans in Congress are looking to expand health savings accounts
Yes.
as a way to pay for premiums. Now, are those health saving accounts always tied to an employer? Because if you're an individual, can you start your own health savings account?
Yes, you can,
Okay.
as long as it's tied to a high deductible plan. It isn't tied to the employer. Usually employers offer these plans.
Right.
In fact,
These
I have one of
HSAs?
these.
Okay.
But it's tied to the insurance plan. It's a high deductible plan, and you're allowed to set aside money to pay for
Pre-tax?
those deductibles, pre-tax, for those deductible costs like co-pays, medicines, et cetera, that you have to pay out of pocket. That's what the HSA money is for. It's not for the premium. It's for your day-to-day costs. So you're on the hook for the premium cost, again, with, under the proposals that we've seen, a tax break that doesn't kick in
Right.
until you do your taxes a year later. So currently, let's say you have a policy on the exchange, and the sticker price is $200 a month.
Right.
But you qualify based on your income. You make, $35,000, $40,000, $50,000, and you qualify for some kind of a subsidy, a tax break subsidy. Right now, they advance you that subsidy month to month
Right.
to reduce your price down to, say, $100 a month. That makes it really affordable, makes it a good deal. You don't qualify for the tax break at the end of the year because
Sure.
you've used it throughout the year. But that advanced payment
understand.
really makes a huge difference, and we're going to lose that under this proposal.
I understand, though, in California, the total amount of the subsidy is about $5 billion. If you look at all the folks in the exchange, that's less than $10 billion. Could California backfill at least that element realistically to help those that are at least on the exchange? I mean, our unemployment rate, went from 18% to 8%. And so,
Well, as a former legislator,
Right.
I would say probably not.
Okay.
I was there during the bad budget years. Just this year, Jerry Brown did his budget for the
Right,
year.
the governor.
And it was predicted, Department of Finance predicted that we were going to have a little bit of a deficit. So if you have a little bit of a deficit, which requires cuts already, where are you going to get $5 billion additional?
do you think that the Republicans will be able to pass a plan? I mean, John Boehner, the former speaker, he said he didn't think it was going to happen. The president has said healthcare is harder than I realized. And so do you think we're going to see something come out of Washington?
There are two pieces to this. One is in terms of procedural actions in Congress. In the Senate, majority vote can only pass a budget-related
Right.
piece. So that can only get rid of the taxes that were in there, the tax penalty, anything fiscal they can handle in a majority vote bill, which they have the majority. Anything policy-oriented requires 60 votes.
So you'll come back and explain that to us?
Absolutely.
He is Hector de la Torre. He is a former member of the California State Assembly. He is now the executive director of the Transamerica Center for Health Studies. My name is Brad Pomerance in Long Beach. Thanks for joining us on Local Edition.